Ever wondered how healthcare professionals manage spinal fluid leaks or severe headaches after spinal or epidural anesthesia? In the intriguing world of medical procedures, we'll be exploring two important techniques today: the wet tap and the epidural blood patch. These procedures, often shrouded in complex medical jargon, hold the key to alleviating pain and rectifying complications in many patients. We'll be demystifying them for you, explaining their purpose, their process, and their impact. Stay tuned as we dive into these fascinating procedures. Does a wet tap lead to a post-dural puncture headache? Let's explore. A wet tap or accidental puncture of the dura mater during spinal or epidural procedures can potentially lead to a post-dural puncture headache. This occurs when cerebrospinal fluid leaks out of the puncture site, causing a decrease in the pressure surrounding the brain and spinal cord. This change in pressure can result in a severe headache, known as a post-dural puncture headache. Factors that increase the risk of developing such a headache after a wet tap include the size and type of needle used, the technique of the procedure, and the patient's age and gender, with younger female patients being at a higher risk. Early detection and management of a post-dural puncture headache is crucial, as it can lead to severe discomfort and potential complications if left untreated. Therefore, healthcare professionals need to be vigilant to the symptoms, which can include a headache that worsens when sitting up or standing, neck stiffness, light sensitivity, and nausea. Understanding the link between a wet tap and post-dural puncture headache can help in early detection and treatment, ensuring better patient outcomes. Stay with us as we delve into common scenarios and risk factors associated with these procedures in the next scene. So, when exactly should a blood patch be done? Let's find out. An epidural blood patch is typically performed when a patient experiences persistent symptoms of a post-dural puncture headache after a wet tap, and conservative treatments, such as bed rest, hydration, and pain medications, have not provided sufficient relief. However, the decision to perform a blood patch is not taken lightly. Healthcare professionals must consider several factors before proceeding, including the patient's overall health, the severity and duration of their symptoms, and the potential risks associated with the procedure. For instance, a blood patch may not be the first line of treatment for patients with certain health conditions or those who are on specific medications. The patient's symptoms and clinical condition play a crucial role in making this decision. A severe, debilitating headache that worsens upon standing, along with other symptoms such as neck stiffness, light sensitivity, and nausea, may indicate a need for a blood patch. On the other hand, a mild headache that improves with rest and hydration may not necessitate this intervention. Understanding when to do a blood patch is crucial in managing post-dural puncture headaches effectively. After all, the goal is to ensure the best possible patient outcomes. In the next scene, we'll explore some common scenarios and risk factors associated with these procedures. Stay tuned. Before moving on to the specifics of these procedures, let's take a moment to discuss a vital part of the process: counseling patients about an epidural blood patch. Clear, accurate, and empathetic communication with patients is essential in healthcare, particularly when it comes to invasive procedures like a blood patch. So how can healthcare professionals effectively counsel their patients? Firstly, it's crucial to explain the procedure in straightforward, easy-to-understand terms. This includes detailing what a blood patch is, why it's needed, and how it will be performed. It's also important to discuss the benefits of the procedure, such as the potential for immediate relief from symptoms and the relatively quick and simple nature of the process. However, it's equally important to be honest about the potential risks. As we'll discuss later, these can include infection, bleeding, and nerve damage, among others. It's important to reassure patients that these risks are generally low and that every precaution will be taken to ensure their safety. Finally, healthcare professionals should encourage patients to voice any concerns or questions they may have. This open dialogue can help to alleviate any anxiety the patient may be feeling and can lead to better cooperation during the procedure itself. Effective patient counseling is not just about providing information. It's about listening, empathizing, and building trust. This can greatly improve the overall patient experience and lead to better outcomes. In the next scene, we'll explore some common scenarios and risk factors associated with these procedures. Stay tuned. Now, let's delve into the technique of performing an epidural blood patch. This procedure, while relatively straightforward, requires careful technique and precision. The first step is the preparation and positioning of the patient. The patient is typically placed in a lateral or sitting position, and the area of the back where the needle will be inserted is thoroughly cleaned and sterilized. Next, local anesthetic is used to numb the area, reducing discomfort for the patient. Once the area is numb, an epidural needle is inserted into the epidural space in the lower back. The healthcare professional performing the procedure must be careful to avoid puncturing the dura mater, the tough outermost membrane covering the brain and spinal cord. Once the needle is correctly positioned, blood is then drawn from the patient's arm and injected into the epidural space. This blood will clot and form a patch, sealing the hole caused by the wet tap and stopping the leakage of cerebrospinal fluid. Understanding the technique of performing a blood patch can not only help in ensuring its success, but also in reducing potential complications. Stay tuned as we further discuss the common scenarios and risk factors associated with these procedures in the next scene. Before we dive deeper into the specifics of wet taps and epidural blood patches, it's important to understand the contexts in which these procedures are commonly used. Wet taps, as we've mentioned, often occur accidentally during procedures involving the lower back, such as spinal anesthesia or epidural injections. They can also happen during specific tests like myelograms. On the other hand, epidural blood patches are typically used as a treatment method when a wet tap occurs. It's a procedure designed to seal the puncture site and stop the leakage of cerebrospinal fluid, thus alleviating the symptoms associated with a wet tap, such as post-dural puncture headaches. Now let's talk about risk factors. The risk of a wet tap is higher in certain scenarios. For instance, patients with certain anatomical variations, those who have had previous spinal surgeries, or those who are on anticoagulant medication, may be at a higher risk. Additionally, the risk can increase with the experience level of the healthcare professional performing the procedure. Higher experience generally equates to lower risk. For epidural blood patches, the risks are generally low but can include infection, bleeding, or nerve damage. The risk can be higher in patients who have had previous spinal surgeries, those with blood disorders, or those who are on certain medications. Understanding these scenarios and risk factors can help healthcare professionals make informed decisions and take the necessary precautions during these procedures. Up next, we'll be delving deeper into the specifics of wet taps and epidural blood patches. Stay tuned. What exactly is a wet tap? Let's dive into it. Imagine you're filling a water balloon, but you accidentally pierce the balloon with the filling nozzle. The water that escapes? That's akin to a wet tap in the medical world. In essence, a wet tap is when a needle unintentionally punctures the dura mater, the tough outermost membrane covering the brain and spinal cord, during a procedure such as a spinal tap or epidural anesthesia. This causes cerebrospinal fluid, the clear, colorless body fluid found in the brain and spinal cord, to leak out. Now, why might a wet tap occur? It's often an accidental occurrence during procedures that involve the lower back, like spinal anesthesia or epidural injections. It can also happen during a myelogram, a type of imaging test for the spine. Despite the best efforts of healthcare professionals, the dura mater can sometimes be difficult to avoid. The benefits of identifying a wet tap are significant. If detected during the procedure, immediate steps can be taken to mitigate the effects of cerebrospinal fluid loss. This can help in avoiding potential complications like a severe headache, known as a post-dural puncture headache, which is caused by the decrease in pressure of the cerebrospinal fluid. However, the occurrence of a wet tap isn't without its potential complications. Alongside the aforementioned headache, other complications can include hearing loss, tinnitus, and in rare cases, cranial nerve palsies. These potential complications underline the importance of careful technique and experience in procedures involving the spine. In the grand scheme of things, wet taps are a relatively rare occurrence, with estimates suggesting they happen in less than 1% of spinal or epidural procedures. However, when they do occur, they can have significant implications for patient well-being, making their understanding crucial in the field of healthcare. So that's a brief overview of wet taps. Now let's move on to understanding epidural blood patches. Now, let's delve deeper into when an epidural blood patch is indicated and when it's not. After we've understood what a wet tap and an epidural blood patch are, it's essential to understand when and why a healthcare professional might choose to use an epidural blood patch. Generally, this procedure is indicated for patients who have a cerebrospinal fluid leak and are experiencing symptoms like severe headaches, hearing loss, or tinnitus that don't respond to conservative treatments. It's also used when the fluid leak is significant enough to cause a drop in cerebrospinal fluid pressure, which could lead to more serious complications. An epidural blood patch may also be necessary if a patient has already had multiple lumbar punctures or epidural procedures that have resulted in multiple dural punctures. On the other hand, there are certain situations where an epidural blood patch is contraindicated. These include when a patient has an infection at the site where the injection would be given, or a systemic infection that could potentially spread to the central nervous system. It's also contraindicated in patients with bleeding disorders, as the risk of causing a hematoma or other bleeding complication is higher. And of course, if a patient has an allergy to any of the materials used in the procedure, an alternative treatment approach would need to be found. Knowing when to use and when not to use an epidural blood patch is crucial for patient safety. It's a balance of weighing the potential benefits against the possible risks and making an informed decision based on the patient's unique circumstances. In the next scene, we will discuss the actual procedure of the epidural blood patch. Epidural blood patches may sound a little intimidating, but they're actually quite straightforward. Think of an epidural blood patch as a natural band-aid for your spine. It's a medical procedure primarily used to treat a condition known as a spinal headache, which can occur after a lumbar puncture or epidural anesthesia. The headache is caused by a leak of cerebrospinal fluid, the clear fluid that surrounds and cushions the brain and spinal cord. An epidural blood patch is designed to stop this leak, providing relief from the headache. Let's break it down to see how it works. In this procedure, a small amount of the patient's own blood is drawn and then injected into the epidural space in the spine. This creates a patch or clot that seals the hole causing the fluid leak. It's like plugging a leaky pipe. Now, you might be wondering about the effectiveness of this procedure. Rest assured, epidural blood patches are generally very successful. They provide immediate relief for most patients, with studies suggesting a success rate of around 70 to 90%. However, like any medical procedure, there can be potential complications. These can include infection, bleeding, or nerve damage, though these are quite rare. More commonly, patients may experience temporary back discomfort at the injection site. It's also worth noting, in some cases, a second patch may be needed if the first doesn't completely seal the leak. What's most important is that an epidural blood patch is a targeted, minimally invasive procedure that uses the body's own resources, in this case blood, to heal and provide relief. It's a great example of how the body can sometimes be its own best medicine. Epidural blood patches, like wet taps, are essential tools in the healthcare professional's arsenal, but how do they actually work? Post-dural puncture headache, or PDPH, is a common complication experienced after procedures like a wet tap. But how do we diagnose it? Let's dive in. The symptoms of PDPH are quite distinct. The most common symptom is a severe headache that worsens when the patient sits or stands and eases when they lie down. This headache is often described as dull, throbbing, or pressure-like, and it typically begins within 48 hours after the dural puncture. Other symptoms can include neck stiffness, hearing disturbances, nausea, and even visual changes. To diagnose a post-dural puncture headache, healthcare professionals start with a clinical assessment. This includes a thorough patient history, focusing on the onset, severity, and nature of the headache. They'll also ask about recent procedures, like a lumbar puncture or an epidural, that could have caused a dural puncture. A physical examination follows, with the healthcare professional checking for signs of meningitis, which can present similarly. If the clinical assessment suggests PDPH, no further diagnostic tests are usually needed. However, in some cases, a magnetic resonance imaging scan, or MRI, might be done to rule out other causes of the headache. Remember, early diagnosis of a post-dural puncture headache can lead to quicker treatment and recovery. Knowing the signs and symptoms of PDPH is key, and understanding how it's diagnosed can help ensure the best possible outcome for patients. Now let's take a look at how an epidural blood patch is done. So, how does a wet tap work? It's simpler than you might think. First, let's set the stage. Picture a small, sterile room. The patient is positioned on their side or sitting up, their back curved to expose the spaces between the vertebrae. A healthcare professional, armed with knowledge and years of practice, prepares for the procedure. The first step in a wet tap procedure is the application of a local anesthetic. This numbs the area, making the procedure more comfortable for the patient. Once the area is numb, a needle is introduced into the skin, gently guided between the vertebrae and into the spinal canal. Now, this is where the term wet tap comes into play. Once the needle is in the correct position, cerebrospinal fluid, the clear, colorless body fluid found in the brain and spinal cord starts to flow out. This is the wet in wet tap. The fluid is collected in a sterile container for further analysis. The healthcare professional must be careful during this stage. Too much fluid removal can lead to a drop in pressure, causing headaches for the patient. It's a delicate balance that requires skill and precision. Once enough fluid is collected, the needle is gently removed, and the puncture site is covered with a sterile dressing. The patient is then monitored for a short period to ensure they're feeling all right before they go home. The entire procedure usually only takes around 20 to 30 minutes. It's quick, but crucial in diagnosing conditions like meningitis, multiple sclerosis, or cancers of the brain or spinal cord. The wet tap is an impressive procedure, isn't it? It's remarkable how something so simple can provide such invaluable information, helping healthcare professionals diagnose and treat a wide range of conditions. And that's how a wet tap is performed. Now let's take a look at how an epidural blood patch is done. Let's say you're in a situation where your patient has had a wet tap. What do? Let's discuss the steps you need to take to manage this situation. The immediate step to take if a patient has a wet tap is to stop the procedure. Any further attempts could potentially lead to more cerebrospinal fluid leakage, which could exacerbate the patient's symptoms. Next, the patient should be placed in a comfortable position, typically lying flat. This can help reduce the likelihood of a headache, which is a common side effect of a wet tap. The patient should also be encouraged to take in plenty of fluids, as this can aid in replenishing the lost cerebrospinal fluid. Over-the-counter pain relievers can also be administered to help manage any discomfort. But the management of a wet tap doesn't stop there. There are long-term steps you need to take as well. The patient should be closely monitored for signs of a post-dural puncture headache, which can occur up to 5 days after the procedure. If the patient experiences persistent headaches, an epidural blood patch may be required. This can help seal the hole in the dura and prevent further leakage of cerebrospinal fluid. Regular follow-ups should also be scheduled to ensure that the patient is recovering well and that there are no lingering complications. By properly managing a wet tap, you can prevent complications and improve patient outcomes. It's a situation that requires careful attention and swift action, but with the right knowledge and skills, it's entirely manageable. Now let's move on to our next topic, the procedure for an epidural blood patch. Performing an epidural blood patch involves a few more steps than a wet tap, but it's still a fairly straightforward procedure. Let's delve into the step-by-step process of this intriguing medical maneuver. The first step is the preparation. The patient is positioned either on their side or sitting up, with the lower back area exposed. The area is then thoroughly cleaned and sterilized to minimize the risk of infection. Next, the healthcare professional will numb the area using a local anesthetic. This is done to ensure the patient's comfort throughout the procedure. The anesthetic is administered using a small needle, which might cause a slight sting, but this discomfort is usually short-lived. Once the area is numb, the actual procedure begins. The healthcare professional will then insert an epidural needle into the epidural space, which is a space in the spine where the blood patch will be administered. This is done very carefully and under the guidance of imaging technology to ensure the needle is in the correct position. The next step is the extraction of a small amount of blood from the patient. This is usually taken from the arm and is done in a sterile manner. The extracted blood is then injected into the epidural space through the previously placed needle. This blood will coagulate and form a patch, sealing off the site where cerebrospinal fluid may be leaking, which is often the cause of severe headaches following a lumbar puncture or epidural anesthesia. After the blood patch has been applied, the needle is carefully removed, and the injection site is cleaned and bandaged. The patient is then monitored for a short period to ensure there are no immediate complications. And there you have it, a step-by-step walkthrough of an epidural blood patch procedure. From preparation to the final monitoring, each step is carefully executed to ensure patient safety and the success of the procedure. That's the procedure for an epidural blood patch. Now let's summarize what we've learned today. Well, we've covered a lot today. Let's recap the key points. We began with an overview of wet taps, which are procedures that involve the withdrawal of cerebrospinal fluid for diagnostic purposes. This procedure is most commonly used to diagnose conditions such as meningitis and multiple sclerosis, and it can also be used to administer anesthesia or to inject medication. We then moved on to epidural blood patches. This is a procedure used to treat post-dural puncture headaches, which can occur after a wet tap procedure. During an epidural blood patch, a small amount of the patient's own blood is injected into the epidural space near the site of the original puncture. The blood clots and seals the hole, preventing further leakage of cerebrospinal fluid and relieving the headache. We also dove into the nitty-gritty details of how these procedures are performed. A wet tap involves the insertion of a needle into the subarachnoid space, while an epidural blood patch involves the injection of blood into the epidural space. These procedures, while they may sound daunting, are common in the medical world and have proven to be extremely effective in diagnosing and treating certain conditions. However, like all medical procedures, they carry some risk and should always be performed by trained healthcare professionals. Remember, these procedures, while common, should always be performed by trained healthcare professionals. Thanks for joining us today. Stay curious, stay informed.